Hi, my name's Phil. I talk about politics, and in amongst all the government cock-ups, they're about to embark on yet another one. So what I'd like to do in this video is discuss the government's announcement that it will be scrapping Public Health England, which is the agency that oversees healthcare matters in England, during the worst pandemic of our lifetime, and wonder whether it has merit, or is it just another attempt for the government to blame someone that is not the government. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So reports were coming out at the weekend that the Department of Health would be scrapping Public Health England, which the government are now trying to blame for the piss poor COVID response, and replacing it with a shiny new agency modelled on Germany's very successful Robert Koch Institute. All sounds very nice, of course it does. Public Health England was brought into being by David Cameron because he was too lazy to run a government. So he wanted to shrink the whole thing, breaking up public services. So from that point of view, the motivation for the creation of Public Health England was not that great. But separating government from oversight of health matters in England is what has caused some problems for the current government, because although it's a government agency within the Department for Health, it enjoys a certain level of autonomy, and it's not under the direct control of the Health Secretary, Matt Hancock. So what that means is they have been giving information to the public about COVID that the government rather they had not. This is one of the reasons why the government absolutely determined that a lot of COVID testing was done by a private company, Serco, which is of course cocking it right up, because Serco would not be sharing their data with the public. But any testing that's happened in hospitals is, and this is the real reason, of course, that the government are wanting to scrap it. I mean, consider this. So the government keep telling us that our response to COVID has been world beating, that nobody else in the world has done a better job than us. That is what Boris Johnson keeps saying. And that any apparent failings were actually just down to the unprecedented nature of the fast-moving crisis. For which, of course, you know, that's perfectly understandable that people will make mistakes. But if that is the case, why are they now saying that actually Public Health England have performed very poorly and they've failed us? Shouldn't they be getting the credit for our world-beating response? But there we have the cognitive dissonance, of course, that pervades British society in a depressingly Orwellian way. Our response has both been superlative and a dismal failure at the same time. A real Schrodinger's cat of a COVID response, with each mutually exclusive state of affairs existing when it suits the government, depending on who they're talking to and what they're talking about, and can change several times a day. But what amazed me is that the report, which was in the Sunday Telegraph first of all, suggested that Public Health England would be shut down next month. Now, regardless of whether you are willing to believe that there are problems with the agency, and undoubtedly there are, ask yourself if it's really a good idea to shut down your public health organisation in the middle of the most serious healthcare crisis that we have known. You know, and especially with COVID cases back on the rise. This isn't like we've got through the crisis and they're now going, okay, let's see what wasn't fit for purpose and let's improve on it. Because that would be sensible. Obviously, you'd like to think a review would be held first rather than just going, we're just going to do this thing. Throw a dart at the dartboard. Yeah, we'll do this thing. But here's the thing. It's going to be replaced with a new and better agency. Says the report anyway. But there are a couple of problems that I can foresee with this. The first is that whenever you create a new system, you know, even if it is modelled on a very successful template in Germany, you are going to have problems because you will have new ways of working. So the people who had one way of working are now going to have another way of working and have to connect with different people as well. New systems are always going to throw up conflicts that need ironing out. Teething troubles, if you like. This is more than a little problematic at any time, let alone when you are actually in the middle of the crisis that you need this organisation to help you with. And if that, you know, let's say you somehow believe that the government have noble motives for this change and the competence to carry it out, it would still be incredibly difficult. and not at all possible to do so in a few weeks. But are they noble and are they competent? I mean, on the evidence of their handling of literally everything else that they've had to handle. You'd be a fantasist to think that, I would argue. But then the second problem is, I would argue, an even bigger one, because the report claims that the new agency won't be fully up and running until next spring. Okay. But apparently the purpose of this new agency, which will not be fully up and running until next spring, is to help with the second wave, which could well be starting right now. The evidence would suggest that it is, but certainly will hit long before spring. So within a few weeks, if the reports are true, and the government have not contradicted them to my knowledge, Public Health England will be no more. That's what it's saying. Technically, we will have the new agency, which is the National Institute for Health Protection. Sounds nice, except it won't be fully up and running for over half a year. So we're going to deal with what may be a much worse COVID wave than even the first, as if that wasn't bad enough, without any agency in overall control of the process. Now, is it just me? Or does that sound a little bit mad? Because we're actually during the worst health crisis for a century. And this is what we're doing? Now, what this is another in a long line of attempts to distract from the government's failings. They first of all tried to blame NHS workers for COVID failings, whilst having the nerve to applaud them each week. Then care home workers, then scientists, then the general public. It's all your fault. Then Spain, then France, and now Public Health England. And they have no boundaries. They have no moral boundaries whatsoever. In order to divert blame away from themselves, they will set fire to the country. In order to blame someone else this time, and that diversion of blame may only work for a few weeks, they are willing to completely restructure England's healthcare system as we are bracing ourselves for a terrible winter combination of second wave COVID, winter flu, and oh, while we're at it, let's just throw Brexit in there as well. And the most worrying aspect of this for me is that it will absolutely go disastrously wrong. This isn't just an evil scheme. This is an evil scheme that will go disastrously wrong even by the evildoers' designs. Boris Johnson, Dominic Cummings, Dominic Raab, Priti Patel, Matt Hancock, Michael Gove, Gavin Williamson. These are the people calling the shots in our government. They are all fundamentally incompetent. You know, and now, don't get me wrong, I oppose this government because I oppose their political way of thinking as well. So I would oppose a competent Conservative government as well. But you've got added onto this huge level of incompetence, which is far worse. They have actually cocked everything up. Everything. Whenever they ever managed to what appears to achieve anything, it's because circumstances which had nothing to do with their designs. You know, the only reason they now have a stranglehold on Parliament is because the leaders of the opposition parties have allowed them the opportunity to have that general election that gave them that 80-strong majority. The only reason Conservative MPs are allowing Boris Johnson to go through with this nonsense is because they obviously don't feel there's anyone they can really get behind as an alternative. So it's the incompetence of their own members. And Conservative MPs know that the government's performance is not good enough. You know, they are constantly briefing journalists about their dismay, how annoyed they are. Yes, they should be doing more than moaning, but these are people who share Boris Johnson's political ideals. And even they know he's crap. You know, this government could not organise a piss up in a brewery, and the only reason our COVID damage hasn't been even worse is because there have been some agencies not directly under the control of these charlatans, these cock-up merchants, and we're about to remove one of them. Oh, and let us say that you have a slender thread of hope that the government can somehow make this work. After all, it's going to be modelled on a successful template from Germany. So you've got this slender thread of hope that it might work out. Okay, let's see what we can do about that. So the person proposed to head up this project is Dido Harding. This for those who don't know, is the cock-up merchant with a history of messing things up when put in charge of anything. Was put in charge of our test and trace program and promptly messed it up. And that is still not working even now. So how's that slender strand of hope doing? This will be a vehicle for accelerating the privatisation of the NHS until there is little enough left of it by the time the next election comes round. This is going to be a disaster. But there you go, those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.